My name is Dr. Dickens Lubanga. I'm a pediatrician based at Bungoma Children's Hospital in Bungoma. So today's topic, we are talking about autism spectrum disorders. So usually what we do is we define them first so that everyone understands what are autism spectrum disorders. And then we are going to discuss the presentation. How does autism spectrum disorder present? And then how the causes of autism spectrum disorders. And then after discussing the causes of autism spectrum disorders, we are going to see how sometimes you control the symptoms that are associated with autism spectrum disorders. So in terms of definition, we are talking about disorders, which is a group of disorders that cause difficulty, and they normally present in early childhood, and they present all the way to adulthood. So usually when these children are young, they're going to have communication challenges. Communication, that means interaction, or basically social interaction between the child and other people is actually impaired. So there's that problems in social interaction and also language development. So you'll find that these children might not be able to talk as soon as other children with similar ages who are able to speak faster than these children. Then another important characteristic of these autism spectrum disorders is repetition. They like repeating things. So either they can repeat words. In terms of behavior, they can repeat some mannerisms like flapping their hands. They like putting their things in one place, and usually they might tend to repeat that. And if somebody comes and interferes with where they've put something, then they tend to be very, very emotive. Sometimes they get very angry and they like their things arranged in a particular manner. If someone comes and disarranges, then usually there's a problem. Another notable thing is that they tend to avoid eye contact. So someone with autism spectrum disorders, majority of them will not have direct eye contact because they've got very poor social interaction. Basically, we say that they like staying in their own world. So they don't want to stay with other people. They prefer playing alone. When they're put where there are so many people, they get scared, they get agitated, and they easily want to run away to the people they're used to. And that's why most of the time, they'll either get used to one or two people. And like we said, they have got very poor social interaction skills. So the main issue is that these children, usually it comes early, and mainly you'll notice because of delayed development. So usually a child is supposed to start babbling sounds, let's say by around 6 months, 7 months. They're supposed to start saying at least one word by 1 year. So they can say the mama, baba, according to the language that is most spoken there. So that is what they'll pick. After 1 year, at least a child should be able to speak at least 2 words, probably baba chapa, mama chokoza, 2 words sentences. So for these children with autism spectrum disorder, most of the time the parents will realize that does not happen. And these children like playing alone. They like hiding with their toys alone without interacting with other children. And they like doing repetitive activities by themselves. And so that is one hint that will give you that there's a problem with this child, because the child is not socially interacting. They don't want to have direct eye contact with you. Now, because we are calling it a spectrum, we are saying autism spectrum disorders, it's a spectrum. There are about 4 diseases because not all of them will present the same way. And that's why we are saying that there are some which will be mild, there are some which will have moderate symptoms, and those ones which will have severe symptoms. So, and right now there's been an increase in the cases of autism spectrum disorders. We're not saying that there's any change in terms of what we have been doing previously, but right now there's more awareness. More people are starting to know about autism spectrum disorders. More doctors are now comfortable in terms of making a diagnosis of autism spectrum disorders. And also teachers in our education system have also been empowered to identify those children with either speech problems in terms of language problems, and also with those with social interaction. So those are children that might be identified early on in the interaction, and usually if it's identified early, a teacher might try to employ some measures to try to reduce the severity of the symptoms that are associated with autism spectrum disorders. Like we said, it starts in early childhood, that's from around 12 months. Because that's when you realize that there's a problem in terms of their social development. And then the symptoms progress. They progress. There's one type of autism spectrum disorder, which is called Asperger's, that sometimes might cause a normally developing child who attains normal milestones up to around 18 months of age. Then they suddenly lose all of them. So a child who was able to walk, a child who was able to talk, a child who was able to play with the others suddenly loses all those milestones that they have achieved, and they go back to zero. So that is also another variation of autism spectrum disorder. And like I said, there are about four further types of autism spectrum disorders. Now, when you come in terms of their causes, so what is this that is causing these autism spectrum disorders? So one thing is interaction between genetics and the environment. So there are those things that make it favorable for you because you have specific genes, or you are born in specific lineage. And also there are some environmental factors that might make you, even if your genes were okay, you are not going to get autism spectrum disorder. But since you have those environmental factors around you, they might cause you to develop this autism spectrum disorder. So, but you're saying up to 90%, 60 to 90% are actually because of genetic issues, genetic mutation. And fathers above 40 years, that's paternal age above 40 years, are meant to be a big risk factor for children who are being born with the autism spectrum disorders. And also advanced maternal ages also predisposes the children born from having into having some of these autism spectrum disorders, because the more you age, the more the genetic changes in either your sperms or your eggs. And so this causes some variation, and it might produce either a very active child or an inactive child. And basically, the neurodevelopment, that is, their brain development, becomes impaired compared to children who are normal, who are born by younger parents, that is, by the age of below 40 years of age. Now, in terms of, so you have said in terms of genes, we have between 60 to 90%, and then there are environmental factors. Now, environmental factors start right away from pregnancy. So, does the mother has convulsive disorder or epilepsy? Which drugs are they using, and do they inform their doctor that they're using those drugs in the course of their pregnancy? We have diseases like hypertension in pregnancy, preeclampsia. We have other diseases like diabetes in pregnancy. All this will predispose the child who is born to getting autism spectrum disorders. We are talking about also the events that just happen just before birth, because that's why the birth process is very, very important. How's the child born? Is there any bleeding that happens just before birth? Is there any did the child cry well? Was the birth handled very well? Because those are some of the things that can result in autism spectrum disorders. And in terms of environment, there can be some chemicals within the environment, like pesticides, which can also increase significantly the chances of a mother giving birth to a child with autism spectrum disorder. And but majority of these are maternal conditions. But you are saying these are only about 10%. So there's no known really cause of autism spectrum disorder, which majority of it is the genetics. Now, how do we make a diagnosis? Usually, diagnosis is made. There's a diagnosis by the DSM-5 criteria, whereby which tends to look at those the things you have mentioned in terms of social interaction challenges, and also speech delay, speech delay, that is issues with language. Remember, language is one thing that helps us to communicate with each other and also issue instructions and also learn. Socially, they have difficulty in terms of learning, and also they have difficulties in terms of relationships. You find that these are people who do not like other people because they have not been, their mind is not tailored to having people around them. Socially, they're going to have challenges in establishing meaningful relationships, and if they do, then they really need someone who understands them, which sometimes might be very difficult because they don't know how to share emotions. They don't know how to be happy. They don't know how to be sad. So basically, they're just, and they might not show you that they're happy, they're sad. So they don't know how to react to events. When other people probably are laughing because there's a joke somewhere, they might actually feel like you're laughing at them during that episode. They might not understand that you're laughing, maybe because someone has spread a joke that maybe everyone else finds is interesting, but for them they'll find it a bit non-interesting to them, and they might find it a bit offended. Most children with autism spectrum disorders tend to take things as they are, so you cannot joke with them. They take things straight. You cannot enjoy them and say, now I'm going to do this. That's how they take, like that's what you're actually going to do. So they don't know if you're joking with them or they believe everything you say is the truth. And so that's why we really need to tell them the right thing and also to ensure that we don't enjoy them because them they not understand that these are jokes because they've got problems with social interaction and also establishing friends. Now, the second aspect is about repetitive behavior. Here we are talking about this can be physical in terms of flapping the hands. In terms of if they're having a toy, instead of them focusing on the entire toy, they can just focus on the wheels, let's say, of a car, and that is what will really interest them. And then they'll tend to focus. If it's singing, they'll tend to like one thing, they're singing, and they like particular music. So when it's plays, they feel they're comfortable, and they do not want other kinds of activities. So they like repetitive behavior. So if they're used to a specific person, that's the kind of person they're used to. If someone else comes in and is a bit new, then they find it very difficult. They find it quite challenging to interact with them. And usually they have got a lot of issues in terms of social interaction and those repetitive behavior they tend to have. Like I said again, if they're having toys, they tend to hide and play with them without having eye contact. They don't look at you directly. And you need to be very careful because sometimes you might think they're actually looking at you, but when you look at them in the eye, they tend to look sideways because that is they're not meant to interact. They just have difficulties in terms of personal interactions. So those are the main things that actually these children might present with, and usually they might have other associated symptoms. There are some who might have hyperactivity. Hyperactivity means it's a child who does not get time to just sit down for some minutes without being disrupted. So a child who cannot maintain concentration, a child who is always on the move, is always touching this, is jumping up and down, is on the TV, a few seconds is somewhere else. So those are some of the complications that some of these children might have. There are those ones who end up also having convulsive disorders. So convulsive disorders are disorders that cause either epilepsy, and so some of them might be impaired because you are saying the problem is the neural development. So anything that can cause that then can also affect that. We are saying also they are going to have learning disorders. In terms of learning disorders, either it can be in terms of mathematics. So those with mathematic disorders, it means they're not able to appreciate or understand mathematics or any addition, subtraction, multiplication, division, and all those concepts. So these are just children who might never do well in additions and mathematics. That these ones will have issues in terms of learning, that those ones will have problems in terms of pronunciation, so that they might not know how to pronounce specific sounds, they might not be able to know how to read out specific sounds. They're also going to have spelling difficulties. And most of the time, the teachers will actually get to the attention of the parents that this child is special, requires more time, requires probably a special school or somewhere whereby the teacher can give more attention. Because like you said, these children don't interact with others. In fact, even establishing rapport with the teacher sometimes can be very difficult. And that's why they're special. They require a lot of understanding. And these are children who might not speak. So sometimes we have issues in terms of Social issues. These are children can get lost anytime because they're not talking. They're not talking to strangers. So usually most of the time, sometimes we have them bands. We have them wear bands either with a phone number of a person they know or their contact or a name of somebody they know so that they can be able to, in case they get lost somewhere or they move out and they're misplaced, then there's somebody else who can be able to assist them locate where their homes are or to which place they belong. So these are some of the challenges that usually happen with these patients with autism spectrum disorders. Now, how do we manage these autism spectrum disorders? Now, before I go to managing, we have talked about the presentation, the early childhood. So you're talking about even adults, they still have the same presentation. They've got difficulty in social interaction. If it's a boy, he cannot go to a lady and tell her, for example, I love you or I like you or anything to other people. So they find this they're a bit withdrawn from the rest of the people. If it's a girl, the same thing. She's withdrawn and she doesn't want people around her and she prefers being alone. They prefer staying in a secluded environment. They prefer having these indoor activities. When you expose them or you flood them to a place where so many people are, then they tend to have issues in terms of their the interaction. So, and sometimes they might lose job because they don't have teamwork. So most of them tend to be alone, and most places of job will require people probably to sync together and be able to achieve a given objective. So that is what sometimes can happen, and they've got problems with their marriages, they've got problems with their friendship, their jobs. Basically, they're not understood because they do not behave like the normal people. So there's no real cure for autism spectrum disorders, but there are things that we do, especially during the early childhood, to assist these children. One is the special diet for them. The special diet that help them to avoid hyperactivity, and also for those children who have got hyperactivity, there are some drugs that we use to avoid that hyperactivity so that they can sit down and be taught. Remember, children have got low concentration span, yes, but at least we expect at least 15 to 30 minutes concentration span from a child. But those ones who are not able to concentrate even for 2 minutes, it means you are not able to learn. Even if you told them, sit and write this, the head is thinking about something else, so they might not actually be there. So there are drugs that we give them to help them to have that concentration and be able to learn. Then, so we have diets. So initially, we prefer diets that have more of the lipids, lipid-like diet that have ketones, because that helps them. Because when you give them, we tend to restrict carbohydrates because carbohydrates tend to give them more energies, and they can easily, they tend to disturb more whenever when they have that sugar rush and compared to proteins, which takes a bit of time for digestion and also releases energy a bit slowly. Then the speech occupation therapy that we do offer. This occupation therapy, or basically call it rehabilitation. So it might include a speech whereby uh, we have speech therapists who train them. They're able to help them understand some words and also pronounce some words. And then they also teach the parents how to interact with them when they're at home so they achieve some kind of communication. Like we said, there are different types. There are those ones which are mild, there are those ones which are moderate, and those ones which are severe. So we start therapy usually early enough, and so that we can achieve some results. Those who have got convulsive disorders, we do some tests like EEG, we do some tests like even CT scan or sometimes MRI, so that they can give us a way forward in terms of starting anticonvulsant drugs, so that these children can actually be assisted. Another thing is that we advise them to go to special schools where there are teachers who are trained especially to handle them, because not all teachers have the patience of interacting with a child with special needs. The only challenge currently is that the government has very few schools for such kind of special children. And those ones which are there, they're grossly underfunded. They've got so many children with very few teachers who are able to teach them. And so these children do not end up enjoying the same childhood like other children. And it sometimes gives significant pressure on their parents because their parents have to be there. They don't know if the child will get lost. They don't know if the child will go back to school. They don't know if somebody can harm their child because this is a child who is not talking very properly, who will not come and tell you this happened, or probably this did not happen. So usually it's a bit of challenging, and that's why we're also advocating, especially for those children with autism and those parents who have got children with autism spectrum disorders, that we find ways of supporting them. But usually the community will tend to laugh at such children. So they meet them somewhere, then they start asking, how comes this 10-year-old boy or 10-year-old girl is not able to talk? How come this child is not responding? So he might find he looks a bit rude, because usually when a child, especially African tradition, when you are speaking to a child or greeting them, then you expect some greetings in a respectful way. But you find this a child who will not even understand that you are greeting them, so they just look at you. They might not even look at you. They might even look down because they have got poor social interaction, and so you find that the interaction, it needs people support system. It needs people who are able to understand that we have such kind of children in within ourselves, and so that we raise that awareness, so that parents or caretakers who have got such parents, they don't have to over-explain themselves whenever they meet people and people start questioning how comes this one behaves differently. Because all in all, God created us differently, and we all need to survive. Nobody chooses to be born on this earth, so we all need to survive. And having a diverse human being population. That's why there are people who are black in color. There are those who are extremely white. There are those ones who are maybe brown. There are those with dark eyes. There are those. So we need to appreciate our people so that we all survive. We all survive. So all in all, we are raising this, especially in Bungoma. There's been quite a group that's coming up, and we are telling the mothers not hide these children at home. Please bring them up. We have pediatricians both in public facilities and also in private facilities that can be able to assist you. Although these children might not live their full lives like other children, but we help them at least live some kind of life that even might help them to survive. In case there's fire, at least they can run away. In case there's a danger, at least they can know when to run away. And that is the most important thing that you're able to do. That will give them skills that will protect them until when um, probably in the adulthood. Thank you.